Hi, good morning all. I'm Dr Anantha Padmanabha, Senior Consultant Physician and Dermatologist at Fortis Hospital, Nagarbhavi. Let's know something about Herpes zoster, which is called shingles, and the vaccine which is there for that. So basically this herpes zoster actually it evolves over a period of time. The varicella-zoster virus is the cause for chickenpox in the early age groups. It affects the young individuals, it will be relieved and cured, but the virus remains in the body and it will have a latency period. And when somebody crosses 50 years and above, the latent virus which is in the dorsal ganglia may strike again and come back, causing herpes zoster. So this herpes varicella-zoster is a virus disease which causes herpes zoster, and probably there are a few people who will get affected more. These are like people who are more than 50 years of age, and people who are immunocompromised, people who have a connective tissue disorders, people who are on immunocytological therapies, people who have got chemotherapies done, people with cardiac failure, liver failure, heart failure, and so on. Such people will be affected by herpes zoster virus. There are few variants which causes with this disease. The herpes zoster dermatome is most commonly the thoracic one, which is in the middle part of the thorax, and there can also be herpes zoster ophthalmicus, which can cause shingles in the eyes, which may sometimes lead to blindness also, which could be sometimes permanent without a cornea transplant. Now when we talk about the epidemiology, almost the variations in the epidemiology we see with herpes zoster, almost from 15% to 80% of the people may also get affected. So lesser the age, little better. As one age is more, it can affect actually more people. So it dramatically increases after the age of 50 years. Generally, when the virus gets reactivated, it affects one side of the body, the dermatome where the virus, where the nerve travels, that part is affected. So initially there could be a little fever, body pain, and there could be a burning sensation, after which vesicles, papules or pustules may erupt, causing infections. So the most important thing for us is disfigurement cosmetically and the morbidity, what we go through with herpes zoster. Later on, almost some 10 to 50% of the people go on to develop post-herpetic neuralgia. Now we are talking about post-herpetic neuralgia actually, which can be severely debilitating persons. There are instances wherein people have committed suicides because of the intense pain associated with this. This is actually the gist of, as people are now actually living longer than 75 years, 80 years and all, the incidence of herpes zoster is becoming more and more. So with our better advancement in technology, with better knowledge, with advanced age a person is living, the diagnosis of herpes zoster is becoming more and more, and the morbidity associated with that is also more and more. Luckily we have vaccines for that nowadays. Probably since few months and a year or so, there are the vaccines available for this herpes. There is a multinational company which has come up with the good vaccines, so for this shingles. So basically somebody who is above 50 years of age can take this vaccines. It comprises 2 doses. First dose if you give intramuscular, say suppose today, the second dose falls after 2 to 6 months, anywhere in between that. So almost 70-80% of the efficacy is there with this vaccinations, and almost it may last for 10 years also. So one needs to get vaccinated as we speak about. As of now, the adult immunization program, adult vaccination, which was almost like neglected, it has come into effect actually. As I was speaking, since one age is more and more and one is living more and more number of years, they would be exposed to more and more diseases, which in turn causes the other diseases to crop up also. So to prevent such thing, it is better to actually get immunized. This vaccine can also be co-administered with other attenuated vaccines. There won't be any issues at all. So I would advise probably anyone who is more than 50 years or anyone who is having comorbidities or anyone who is on chemotherapies or post chemotherapies and all, to take the shingles vaccine, which is of 2 doses. Please ask your doctor for further information. That's it. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.